Let's talk about the causes of cerebral palsy. The exact cause of most cases of cerebral palsy are unknown, but many are the result of problems during pregnancy, in which the brain is either damaged or does not develop normally. This can be due to infection or maternal health problem, which can result to lack of oxygen supply to the fetal brain. Problems during labor and delivery can cause cerebral palsy in some cases. Factors that can cause cerebral palsy are categorized into three areas. Like we have the prenatal, perinatal, and postnatal. The prenatal is before birth, perinatal during childbirth, and postnatal after childbirth. We also have preconception factors. We have the biological and the genetic factors as well to be considered. So for the prenatal causes of cerebral palsy, we have infections, malnutrition, toxics, environmental factors, metabolic disorders, and then we have perinatal, birth injury, prolonged labor, which also leads to lack of oxygen, endocrine deficiency. Then postnatal causes of cerebral palsy, we have traumatic brain injury, infections such as meningitis and brain tumor. So these are factors that are likely to cause cerebral palsy. Premature babies, especially those who weigh 3.3 pounds, have a higher risk of having cerebral palsy than those that are carried full term. Cerebral palsy affects muscle tone and coordination. So it makes simple activities that requires fine and gross motor skills difficult to perform for those who are affected by cerebral palsy. Like standing still becomes difficult, like walking in a coordinated manner is difficult, as well as performing activities of daily living, like I've listed earlier. They are all affected due to the multiple problems that are involved. Now let's talk about cerebral palsy categorization according to clinical features, limb involvement, and degree of severity. So I will start with the clinical features. We have spastic cerebral palsy. This causes stiffness and movement difficulties. And then we have atetoid, which leads to involuntary and uncontrolled motor movements. Then we have atasic cerebral palsy. This causes a disturbed sense of balance and depth of perception, poor coordination, and difficulties with quick and precise movement. Mixed type of cerebral palsy may have two or more combinations of the ones I've discussed. So classification according to degree of severity, it could be mild, moderate, or severe. And classification according to limb involvement, it could be hemiplegia, paraplegia, monoplegia, or quadriplegia. Monoplegia can just be either affecting just one hand or one leg. Then paraplegia is affecting paralysis of the lower limbs. Quadriplegia means it affects the four limbs, the two hands, and the two legs. Hemiplegia is affecting, the paralysis is affecting one side of the body, both one hand, one leg on the same side. Now let's talk about signs and symptoms of cerebral palsy. We have developmental delay. Infants with cerebral palsy are usually slow to roll over, sit up, crawl, smile, or walk. And then we have abnormal muscle tone. Children with cerebral palsy may have hypotonia, that decreased muscle tone, or flaccid or relaxed muscle tone, or spastic, that's very tight, increased muscle tone. So that increased muscle tone can also lead to stiffness in the joint areas of the child. Another clinical feature you can also find is unusual posture, which means the child tends to favor one side. You see a child who constantly tilts to one side. It's not that they just want to tilt, it's just that that's the posture they are able to maintain at a particular time. So they tend to favor one side by tilting to one side. If you find this video helpful, please give it a like, comment, and share. Share to your friends, in your WhatsApp group, in your Facebook groups. Please share to your colleagues at work, your neighbors, and let's learn and get ourselves informed on different things that affect children in our society. Let's do this together. See you again in the next video. Bye for now. Bye.